All right. Okay. Well, good afternoon, guys. Thanks for taking time to hop on this week's update call. Hoping to be able to provide you with a little bit of information on data and the numbers, a little bit of information regarding our vaccination plan and what we're looking at. We'll kind of reemphasize the groups that we are currently vaccinating right now, and then answer any questions that you might have. So just like we have done in the past, we'll go ahead and start with data. So Jordan.
Okay, hopefully you're seeing my screen. Are you?
Yep.
Okay. Just want to make sure it was giving me a weird message. So, okay, so you can see this week we have lots of different colors we're seeing. So Lake is in risk level B, Oceana in risk level C, Kalkaska, Manistee, Mecosta, Newaygo, and Wexford are in risk level D, while Crawford, Mason, and Misaki are in risk level E. So starting to see some different risk levels, which is a good thing. The daily cases per million and percent positivity also continue to decrease overall for our jurisdiction. We reported 46 new cases from Friday at 3:01 p.m. until yesterday at 3 p.m. And there were 183 new cases over the past week, Tuesday to Monday. And the week before that, we had 303 cases. So we have seen a 39.6% decrease in cases from the past week. Over this past week, cases have been identified as household and community contact, schools including college and daycares, churches, care facilities, worksite exposures, and recent travel. Our total number of jurisdiction-wide cases as of yesterday at 3 p.m. was 11,224. Our cases by county as of yesterday are Crawford with 535, Kalkaska 530, Lake 334, Manistee 734, Mason 1,120, Mecosta 1,827, with Ferris State reporting 587 cases, Misaki 575, Newaygo 2,553, Oceana 1,753, and Wexford 1,263. In the past week, we had 11 deaths reported and 408 people recovered. Yesterday, there were 3 positive inpatient cases at Munson Healthcare Cadillac, 2 positive inpatient at Munson Grayling, 0 positive inpatient at Munson Manistee, 4 at Spectrum Health Big Rapids, 1 at Spectrum Health Gerber Memorial, and 2 at Spectrum Health Ludington. And then I have the vaccine data to share with you. Let me switch screens here. All right, so here's our table as of Sunday, February 7th. We have given 21,993 vaccines. 8,921 of those were second doses. And this, according to the state dashboard, a total of 37,769 vaccines have been given in our counties. So you can see how many doses DHG number 10 has given compared to how many doses were given in the county overall in this table. Are there any questions?
And Jordan, the state dashboard is by county of residence, correct?
Correct.
I just have one question, Jordan. This is Joseph Fox from Newaygo County Commission on Aging. And I don't know if this message got to you, but I think there was a mathematical error back on February 2nd where you said that there were 23 new cases, but when you added it up, it only showed like 3 new cases or something got added in.
Yes, and I believe that 3 was the correct number. I think 23 had been a typo on the
23 was the wrong number then. Okay.
Picture that had gotten sent out. Yes.
Okay. Okay.
Thank
Very
you
good.
for pointing that out, though.
Yep. Thank
Joseph,
you.
that's my bad. I forgot to get back with you on that.
That's okay. I knew something went awry there.
Yep. Thank you for pointing that out, though.
Yep.
All right, I think we're set with the data then.
Okay, no other questions? Okay. Sarah, are you on?
I am. I'm just a little slow getting to the mute button.
Okay. Sarah, if you're ready, you can kind of maybe do a little update on our current vaccination plan and you know what we're looking like as we move forward.
Sure. We continue to loop back and pick up any out of priority one, which is our healthcare workers. We have a few every week that get added to our list as people that either change their mind or new employees come on board. And so we have a wait list for healthcare providers specifically on our website. And on a weekly basis, we go in, clean them up, and move them to the counties to the top of our call list for vaccinations. And we're doing the same with our priority 2 group, which includes currently our 65 plus. They also have their own priority group, and then our frontline workers. We have been working the last 3 weeks to get our school teachers K-12 through vaccination efforts, and I'm happy to say that this is our final week of school vaccination clinics. The schools are actually coming to our clinics, but we've been providing a block of time for them to schedule their staff so that we can get them into clinics and off our list. Starting next week, new school staff will have to go out and register on the wait list under the frontline workers. And then again, as I said, every week we're kind of reviewing that list, picking them up, dropping them into the local county wait list and calling from there. We are also, or we have moved and really have tried to do this since day one, is to prioritize our senior population per the state recommendation of 75% of our vaccines earmarked towards the 65 plus population. I did not get a chance this afternoon to run that report, but through not including last week, but through the week before, we were I think 8,500 of our 13,000 vaccines so far were with the senior population. Last week was all second doses, and I'm going to guess that out of the 9,600 that we gave, 8,500 were seniors. So I think we're holding our own with meeting that state benchmark, and we'll continue to do that. Once we, again, weekly, we do our healthcare workers first as their highest risk. And then from there, we're going to be doing the 75-25% split. So currently our efforts are cleaning up our schools, working with our childcare protective services, we're looping them in next week. Some of our counties, I get a lot of questions on where are we in the list. Some counties are a little farther ahead. They had less schools to do, so we're able to add some of those other priority groups to the front of the line. But we're currently still sticking with phase 1B, group B, frontline workers of law enforcement, fire departments, and other what we're calling public safety. So including our drivers of snowplows, which we all needed this past week. Also jail staff, correction staff, child care, daycare providers, adult and child protective services. And just to clarify, that does include our staff that are working with foster care homes. Foster care children. And then also homeless shelters, juvenile facilities, other correction facilities, congregate care settings. And we're guessing that's going to take us a few more weeks before we get through those. And Kevin, I know you shared some numbers yesterday, and I didn't pull that up.
Numbers for the formulas?
Yeah.
That they used? Yeah, we had gotten, now I got to find those. The state had shared with us what their projection was in terms of allocating vaccine in the formula that they're using, and so they had shared with us numbers of 70% of the population that is 65 years of age and older, the number of frontline essential workers, school and childcare staff, and then a total population per each county. And this data is from census data. It's from the American Communities Survey. So that's where that information comes from. So looking at our 10 counties, if we look at Crawford County, our target population there for the 1A and the 1B groups that we're currently vaccinating, again for Crawford, is 2,958 individuals. For Kalkaska, it's 3,145 individuals. For Lake, it's 2,848 individuals. Manistee is 5,596. Mason is 5,937. Mecosta is 7,341. Masaki is 2,706. Oceana is 4,900. And Wexford is 5,633. So of those individuals that would be in that 1A group and that 1B group, again, the ones that we're currently vaccinating, those are ideas of what the numbers are of individuals that we can expect to vaccinate in each of those groups. And so as we, we'll be kind of keeping an eye on that and seeing if those numbers are accurate. I know in taking a look at the 65 plus population numbers, they are pretty close to what we had even before the state had released that. So that's just a little bit more information to to share with you on that. So Sarah, I don't know if you had anything else.
Well, just as Kevin read those numbers off, so we have very long laundry lists of people to call, and I'm guessing we're well over 10,000-12,000 people on our wait list. So just asking for a little patience as we work through. The majority of them, of course, are in the 65 plus. We have a lot of we hear a lot of stories about people under 65 that have underlying conditions. And we really, just so we really have to follow the guidelines from the state. And so we're being pretty tough. Does that mean somebody doesn't get in on the sly? I'm going to say no, because I'm sure that happens. We have a lot of people who are claiming to be frontline workers because they can't get in on the 65 list. So it's a little disheartening in the amount of time and energy that goes into kind of weeding through a lot of that. But unfortunately, we're stuck with that. We're being really careful about taking people as they registered. It's the only fair way to go about it. But I know that we do have a lot of people questioning, how come my neighbor got in and I didn't? And it just is. So anyway, any questions?
Yeah, this is Ken Pilat. Did I miss the statistics on Newaygo County? I didn't hear those. It seemed like you went past them.
For those numbers?
Yes.
Newaygo County, and I apologize if I missed them, but Newaygo County was 8,477.
Thank you.
Yep. Okay. Other questions? Looks like there's a couple hands up. I can't.
Yeah, there's also a couple in the chat. So Ken had his hand up, but he just asked his questions. I think we're good with hands. In the chat, Gwen is asking, how much vaccine is DHD number 10 getting weekly, or FQHC is still getting none?
Kevin, do you want me to talk about that, or?
Yeah, because I'm not sure if the number I have is correct or not. If you've got the.
Sure. I can tell you that last week, because District 10 had 9,000 doses of second dose, our allotment from last week got kicked to this week. And so we're doing roughly 2,500 vaccines today, approximately 250 in each county, though some counties, our southern counties really have an allotment of 300 from the state. partly because of the formula of population, but also then the, kind of those social determinants of health risk factors. So some of the counties are getting a 300 allotment today, and some are getting 200. So we have 2,500 from last week that are getting pushed out today. And then on Friday, we have an additional 2,100 that are going out with some Pfizer as well. So if next week stands to hold up as it did this week, our allotment this week was actually 2,100 doses. I wish it was 5,000 every week. That would be awesome, but it's not. So we're expecting 2,100 and then 1,000 of Pfizer. We don't know if the state continues to be able to find Moderna for us, whether they'll continue to give us Pfizer or not. We're in a holding pattern until things kind of straighten out at the state. Can't speak to Gwen's issue on when they might get vaccine. Kevin might have a better answer, but I'm not sure where that lies.
Yeah, I'm not sure on that either, and that's the same answer for like the primary care offices. I'm not sure when that, when they're going to start allowing those facilities to get vaccine or push vaccine out to them. On the call that I was on before this was a state call. They did talk about vaccine and the continued issues that we're having because of earlier on, there was an issue where some health systems and a couple health departments had used vaccine intended for second dose. They used it for first dose, and it's created an issue in that there's not enough second dose vaccines now. So we know that some health departments and some hospitals had gotten shorted on second dose vaccines, meaning they didn't have it to give when it was due. And so what the state is trying to do, they did last week, and they're going to try to do again this week, is to correct that issue. They're taking an allotment right off the top of what what comes into the state, and that's what they're going to use that to fix that up. So Sarah's comment about, we're anticipating that 2,100 of Moderna, maybe 975 of Pfizer. Most likely that's probably the number that we are going to be looking at as an allotment again for, that'll come in this week and will be what we'll be putting out in clinics next week. It's, as of right now, the split between the hospitals and the health departments, 60% of the vaccine goes to the health departments, 40% of what comes into the state is 40% goes to the health systems. That is expected to stay that way for at least the next 3 weeks, and then it'll switch to more of a 70-30 mix. What the state received or is expecting to receive this week is the same amount of vaccine that they got last week, and that was 90,900 doses of Moderna vaccine and 62,400 doses of Pfizer vaccine. And so, as I said, they will be taking an allotment off of that, the top of all of that, and that will be going out to try to fix the second dose issues that are continuing. And so whatever's left is going to then get divvied up as first doses and second doses for everybody else. They also talked about the fact that the feds are going to implement a pharmacy vaccination program, and they have identified 3 pharmacies that will be providing vaccine in the communities: Rite Aid, Meijer, and then Cardinal Pharmacies. And I think I had talked about this. Cardinal Pharmacies apparently are up in the UP. They have about 6 or 9 shops up there. And so the Cardinal Pharmacies are expected to get about 1,000 doses to split between those 6 and 9 stores that they have. Rite Aid is expected to get 20,000, and these doses are not coming off of what's coming into the state. The feds are providing them these doses. And so they're getting about 20,000 doses of Moderna, and Rite Aid's plan is to send out about 100 doses to each of 200 stores. So that's how they're divvying up their allotment. Meijer, on the other hand, is getting 9,500 doses of vaccine, and their plan is to provide 1,000 doses to Meijer stores. Most of them are south of the Kent County area. Traverse City Myers. One of them is slated to get 1,000 doses, and then the remaining 3,000 doses, they're looking at doing 1,000 doses out to 30 stores, and I have no idea where those stores are. The issue with the pharmacy is it's controlled by the Fed, so the state really has no influence on them. So we'll be seeing as to whether or not they're going to follow the guidance that everybody else is following, or if they are just simply going to go and vaccinate whoever comes in. We do know we have had in our jurisdiction, at least in in Wexford and in Mecosta County, we've run into issues with the Walgreens pharmacies who were storing vaccine for McLaren, that vaccine coming towards the expiration date because it hadn't got used up. So they started to vaccinate folks, and we're telling them that they can give them their first vaccine, but they can't give them their second vaccine. They need to go to the health department to get their second vaccine. And again, we are not able to provide them. We cannot guarantee those individuals a second dose of vaccine. We do not order first doses of vaccine. We do not order second doses of vaccine. The state is now allocating our vaccine to us. First doses based on that formula that I talked about, and then second doses are based upon what we get for first doses. So if we don't provide a first dose to somebody, there's no way that we can guarantee that we can give them a second dose of vaccine. So that is creating some issues that we're having to work through. And so in communication with the state to try to get that taken care of, so we don't get those inquiries, because the Walgreens issue, we're talking now probably 15, 16 individuals between the two counties where we've run into this issue. So I think that's all I have on vaccine in terms of information to share. I know there was a question that came in after our meeting last week, and the question related to if someone had completed their vaccination series, so they've gotten both shots, and then they potentially are exposed or identified as a close contact, do they still need to quarantine? And right now, the recommendation from CDC is that yes, they still do need to follow the quarantine guidance. So that'd be the 10 days, provided they don't provide any signs or symptoms. So the other, what we're hearing though is that CDC may be changing that guidance here in the near future. I know we've seen some draft language of it that would no longer require that quarantine period, but we're not sure when CDC may say, okay, this is now what we're going to do, or this is the guidance that is going to move forward. So I expect that we'll probably see some changes, but as of right now, it is that's where we're moving along still under the original guidance, which is even if you've completed your vaccination process, both series of shots, you still and are identified as a close contact, you still do need to quarantine. The other thing, 2 weeks ago, Dr. Morris did share some information on the variants that we're seeing. She shared some information with us from a call that she was on this morning, where they talked a little bit more about that. To date, there have been 40, we've identified 45 individuals that have had that B117, that's the UK variant here in Michigan. Closest one to our jurisdiction, there was a case identified in Charlevoix. You may have seen that. Some of you may have seen that on the news. This person was already, by the time it's identified, the person was past their infectious period and had gone through their quarantine period and all of that. And then there was one case in Kent County where they also had identified that same variant. So again, 45 people so far. The assumption is that it's probably more widely spread than that. We're not testing all positive results for that at this time. They're only kind of pulling a percentage of those to test for that. So I do have that information to share. I think that might be all, other than just to let you know, we still continue to work with our partner with our healthcare systems, Munson to the north, Spectrum to the south, and then communicate with our Trinity or Mercy hospitals to try to make sure we're not tripping over each other as we conduct our vaccination efforts in the community. So Sarah touched on the groups that we're vaccinating. And other than that, that's kind of what I have for today. So we'll open it up to questions, I guess.
All right. There was a question about public transportation drivers from Melissa, but it looks like Sarah had answered that in the chat. So the next question would be from Tammy. She asks, so how are you managing the extra doses that we get sometimes that we have been instructed to give if we can't be assured they will get a second dose?
Right now, the guidance from the state is that you know, if you're getting extra doses in the first dose, and a lot of it has to do with the type of syringe that you're using, and so as long as we continue to use those same types of syringes, and the ancillary kits that come along with the vaccine are designed to assure that we're still pulling those extra doses, that we should have enough, you know, in the second doses that we get to compensate for that. If we don't, you know, one or two people, it's not going to be a huge issue. If we find that, you know, we're short by 10 or 20 or more individuals for a second dose, that's going to be a problem, and we're going to have to work with the state then to try to get that addressed. Has not been a problem so far, though, in any of our second dose clinics. And as a matter of fact, we're also hearing that you know, the original Pfizer volume was 975, but because of the consistency in pulling that sixth dose, that may get bumped up to whatever that extra dose would equate to in all of that. So, but again, nothing finalized on that yet.
All right, and then from Ken, he says, Meyer getting 9,500, question mark.
95 Meyer as a whole would be 9,500 doses that they would disperse out, and what their plan is, of that, there would be 1,000 doses that would go to six stores, I believe, or however that would work out. Most of those stores lie down in the southern part of the state. Like I said, south of Kent County. Grand Traverse County would get 1,000 doses at one of their stores, and then whatever is left over from that. So if it's 30, it'd be about 3,500. They're going to split that up between 1,000 doses out to whatever number of stores it would take to equate that. But we don't know again, because the feds are running this, we don't know the stores that are going to get that vaccine.
That's all the questions in the chat right now. So if anyone is on the phone and wants to ask a question, they can unmute and do that.
Can they unmute, or do they have to do *6 or?
I'm not sure how it works from the phone end. I'm not hearing any, and there's no more questions in the chat right now.
All right. If there are no other questions, and if anybody on the phone does have a question, you can't unmute. If you try *6. If not, and you want to text me or email me the question, we'll get it answered, and then we can share it back with the rest of the group next week on our call. Or if anyone on the call has has a question after the fact, go ahead and email it to me, and we'll answer it and then share it with everyone on next week's update call. So if there are no other questions, that's all that I have. Jordan, any last things for data?
Nothing else from me today.
Okay, and we'll share that information out with you. Sarah, anything else for vaccination plans or clinics?
Not that I can think of. If anyone has questions, feel free to give me a buzz, and I can post those priority groups in the chat, Kevin.
Okay, that would be great if you could do that, just to remind everybody. So again, we're not talking about a lot of vaccine. If we're looking at 2,100 doses of Moderna split between 10 counties, a little over 200 doses per county. We're asking for your consideration and understanding as we try to move through and get people scheduled. It's going to take us a while to get through everybody dealing with those types of vaccine numbers. So, all right, if there's nothing else, thanks guys for taking time to hop on the call with us today. Again, if you have questions afterwards, email them in. We'll provide an answer back to you and then share that answer with everybody on next week's call. And so thanks for hopping on, and we'll talk with you next week. Stay safe, guys.